what we wanted to do actually was to make this a very sort of, I suppose, user-friendly screen here, where one can see side by side the pros and cons, the features and the advantages and disadvantages of three very conventional types of health economic models, which we feel are particularly relevant to the needs of health economic, sorry, of medtech devices going forward. What I wanted to touch on initially is the fact that, of course, these three model types, a budget impact model, a cost consequence model, which we've touched on already, of course, is what's required in the Mtech process, cost consequence, and also a cost effectiveness model. These model types are all focusing on slightly different objectives. The budget impact model, very much looking on a financial basis from the perspective of a budget holder, looking at a relatively short time horizon of 3 to 5 years. And that differs quite notably from the idea of a cost consequence model, where we're actually thinking about, as we've touched on briefly, costs and outcomes. So two different concepts there, of course, but the idea of cost consequence is that we keep those quite rigidly separate, that we have separate domains, a disaggregation between cost and outcome. And we consider what that means. What, in essence, that kind of model is going to be telling you, well, you're going to have this much incremental or difference in cost compared to the standard of care. Also, we're going to avoid this many adverse events. So they're separate considerations, but it's just something more to contribute to the story. And then the cost effectiveness model, very much looking at combining in an efficiency sense, the cost and benefit relative to its comparators of this new medtech asset. So thinking about how much more do we have to spend to attain one more unit of the health benefit that we are targeting. It's also important to note two more things, that these models are all comparative. So it's all about this new medtech device relative to the single or indeed the collection of existing standard of care interventions. And also worth noting that from left to right in this table, budget impact through to cost effectiveness model, broadly speaking, what you see there is an increase in degree of sophistication, resource intensity.